breaking bad news is a challenge, and it needs to be treated with respect. But it is such an important part of our lives every day that I think the more we do it, the better we become, and shouldn't avoid it.
So, Imogen, what's the hardest thing you've had to tell a patient or their family, and how did you prepare for that?
Yeah, I was trying to think about what was the hardest moment. I think, to be honest, it goes back a long way when I was a junior doctor, and I think probably the challenge was that I was not experienced, firstly. Secondly, not experienced at doing conversations. But I was talking to someone who was my age, so it would have been mid-20s, and she'd had a diagnosis of breast cancer 2 years previously and had been well since then, but presented to my hospital, so a different hospital, with, I think, shortness of breath and a small pleural effusion. But it also turned out that she had a large pericardial effusion. And of course, you worried that the breast cancer and the pericardial effusion was linked, which of course it was linked. And then she also complained of a headache. And in those days, we didn't do CT scans very often, but we did. And of course, she had metastatic disease of her breast cancer. Now, appreciating this is decades ago, wasn't obviously amenable to treatment in those days. So here I was, a very young junior doctor, and talking to someone my age who I think had just got engaged as well to, I guess, break the news that her disease had returned. And I suspect I was more nervous than they were. And they were just so lovely in return of my conversation that, to be honest, it was the most humbling experience ever. But it was incredibly difficult for me to know how to broach the subject, but in a way that, it would allow them to understand what was going on and the consequences thereof. But they were so lovely in return, it made the whole thing a little bit easier. And indeed, I think it was my last day in that particular job, and they sent me a well-wishing card for my next job, which, again, was probably, in my whole life as a doctor, probably one of the most humbling experiences ever. It was extraordinary.
And have you had a time when delivering bad news hasn't gone so well? And with the benefit of hindsight, what could have been done differently to help the situation?
Yeah, I was, again, trying to think back, and I suspect my most challenging situation has been where I have spoken to a family the night before about the potential for organ donation. Now, it's always hard when you raise the issue of organ donation when the patient is not actually brain dead, which is the way we used to donate only organs. And so the patient wasn't quite brain dead the night before, but looked like they were going to become brain dead. So I spoke to most of the family, although not all the family, about the potential a brain death could occur, and that as a family they might want to think about organ donation, and that at the time I sensed there was a positive response to that they would want to. And so I went into the next day's family meeting where there was a larger group. So it was probably a difficult environment where I probably had about 15 people that I was talking to. So it's very hard to get a sort of empathic sense at that point because you're talking, in fact, almost like giving a lecture, but trying to keep it in a way that's meaningful to patients and their families. So I assumed, and this is where I went wrong, I assumed that the family was going to be positive about organ donation. And so I leapt into, now as we were talking last night about potential for organ donation, suddenly I got this pushback that they'd all agreed that she wasn't for organ donation because I can't remember the actual reason. So in fact, what I should have done is actually ask the family how they were, what were their current understanding, what was going on. And then at that point, I would have realised that they had not gone down the agreement of organ donation. And I should have, done that and then, to talk about organ donation itself. So my lesson there was never assume anything, which of course I talk about all the time. And the second thing is always hear from the family first, because then you know where they're starting from and then you can take off from there on in.
In your role in the ICU, you probably have to deliver quite a bit of bad news. Does it ever get easier?
No. Yes and no. I think obviously with experience, I think that helps a lot because you've been around and know how families can respond. You also probably have a construct for the way you run your meetings. And in fact, I've had a social worker who says, "Oh yes, and you do this, this, and this." I said, "Oh gosh, I didn't know it was so formulaic." But does it get easier in a sense? Yes, for the structure. Yes, for the experience. But no, because you never know how families are going to respond. And I think I always slightly anxious before going to talk to families because you never know how it's going to go. And I guess I always make sure that that moment in time is very special for them. So I give them my all. I mean, I really do speak from the heart as well as also speaking from my own experience and knowledge to help them through that journey. So I guess if I found it easy, I think there's a problem, because I think each moment is special and should be treated as such.
So up to three things could a medical student or a junior doctor do if they wanted to be better at delivering bad news?
Yes, I'm not sure I can give you three things, but I think to sit with people who you respect and know that can do good family conversations. There are certainly not many, but a few clinicians who are superb at talking with families. And if you are able ever to have that moment to watch and be with them, it cannot be underestimated as to how powerful that is as a learning tool. I think the second thing is, unfortunately, and it goes down to the more experience you have, probably the better you are. So that's hard when you're first starting out. And I think it is hard, I mean, as I said before. The third thing is, I guess I do have a formula. And the formula is before the meeting, you firstly take someone with you like the bedside nurse or a social worker so that there is someone else who's listening to your story such that the family can go back to them if they have some concerns. And you work out who is who in the family, because I think the challenge these days is that there are many families that have various factions, and you need to work out who's friendly with who, and indeed are there people missing, so that when you go into the room, are all the important people here? Because certainly, clinicians have fallen down because they haven't got the right people in the room. So you need the right people in the room and know who that they all are, and introduce yourself to them, explain who you are and who the person you've got with you. And then I guess, explain why you're there, the purpose of the meeting. And then the next thing I always do is get someone, ask for a spokesperson, to help me understand their side of the story such that I can fill in the gaps and then take them forward thereafter. And once understanding their story, you know where to start your own story. And if they feel it's a short time and yet this patient's had chronic lung disease for 20 years, I always take them back 20 years and allow them to understand that this has not been just a short episode of unwellness. And then really slowly go through the patient's story as you interpret it, always seeking to see feedback from the family, facial expressions. And then I guess always give them opportunities to have silences such that they've got time to sink things in and thereafter ask questions. So you give your side of the story, allowing for questions all the way through. And then I think being very clear about a plan, what the expectations are, where we're going to from then, and then seeing if they've also got questions and allowing them to ask questions at the same time. So I think, firstly, understand the family dynamics, know if everyone's in the room that should be, asking them to describe their own story, and then you obviously filling in the gaps and then giving them a plan at the end of the day. So it's not quite three things.